Yeah, and then another question is, just out of curiosity, how was it being a primary care physician for, like, over 130 people?
It was both very rewarding and heartwarming and very stressful and soul crushing.
Mhm,
And it's just the reality of medicine in the United States, right? It was rewarding because I was making such a big impact on people's lives, right? I was helping people, I was relieving pain, I was relieving discomfort, I was getting to the bottom of medical problems, I was taking care of people, which anybody that goes into medicine, that's the core thing you want to do, right? Is to help people. So as a primary care provider, that's what I did, all the time. And it was also, so it was very humbling to be, I was very young. Yeah, I don't want to say the life of 130 people in my hands, but it kind of was, right? In a touch of a button, I could do things that would affect them for years afterwards. So sometimes it was a lot of responsibility as well. And there were some patients, right, that they just glob onto you. You're like the source of
mhm,
all truth, right? And they wouldn't do anything before talking to you first. So sometimes it was embarrassing because I would have very experienced doctors, right? Doctors who have been doing this for 30 years. They would call me and they say, "Hey, can you talk to Mrs. X about this
mhm.
procedure that she needs to have? She won't say yes unless you say yes." And I was embarrassed because I'm like a baby doctor. I've only had, I just graduated a year ago, and this very respected physician is kind of to call me, and I had to be like, yes, I'll talk to her. We'll do. So it was that kind of humbling thing that all these people were very dependent on me, dependent on they wouldn't make decisions without me. So that was very heartwarming to be part of, to be taking care of all these people. But it was also very sad and depressing sometimes because I just I just did not have enough resources to take care of all them like I wanted to, right?
Mhm,
On a typical day, I would see them for 30 minutes.
mhm.
And I don't know if and it's just impossible to get to the bottom to have a satisfactory medical visit in 30 minutes is just impossible. And that is one of the problems that American healthcare faces today is this kind of like assembly line, right? Because they would come
Yeah.
in, they had 30 minutes. I could not extend that time because I already had two other people after them waiting in the rooms, right? So it has to be very tight. And a lot of them were very, very sick with a lot of chronic issues. And the way it works, whenever somebody comes to see you, you have to not only address whatever they're feeling right now, what we call the acute problems, but you
Mhm,
also have to address their chronic problems, right? If they have diabetes, for example, you have to check the progress of their diabetes. You have to look at their sugars. You have to be how well controlled they are. You have to talk about any side effects since you last saw them. You have to do sensory checks, right? Because diabetes causes nerve damage. So you have to do foot checks. You have to do vibration tests. It's a very involved thing that takes 15 to 20 minutes. If they have high blood pressure, you have to make sure their blood pressure is well controlled. If it's not, you have to talk to them about it. Have you been taking your medication? Blah, blah, blah. So as you can see, the more chronic problems they have, the more time I have to spend making sure that those problems are controlled. So if they
mhm.
have any acute problems, like they sometimes there's no time to go through those. And it sucked because a lot of times I would have to ask them literally that to choose what they wanted to talk about. I'd be like, "What do you want to talk about?" And they're like, "Well, I've been having chest pain. My back pain is really bad. And I pooped blood last week." And I'm like, "Oh my God, each one of those is 30 minutes. I don't have enough time." So I'm like, "I need you to pick." And sometimes they would pick the one that, they'd be like, "Well, I want to talk about my back pain." And I'd be like, "Actually, we need to talk about that bloody poop." So
Yeah.
it was like sad, like and I was very unsatisfied every day because I felt like I was not able to do what I wanted. They were not able to get what they wanted. And it was constant without stopping, 12 patients a day. And so those issues kind of like it leads to burnout because you
Mhm.
feel like it's a very Sisyphean task. Do you know who Sisyphus was?
No.
In Greek mythology, he was a person who was condemned to an afterlife or punishment. He had to constantly roll a big rock up a
Okay, so
hill.
I've heard of the story, I just didn't know the guy. Okay, so I've heard the
Yeah.
story, yeah.
So you know what I'm talking about, right?
Mhm,
So it's kind of become like a byword for futile tasks. So in many ways, it felt futile. It felt like I was not healing them. I was not curing them. I was just band-aiding them, bandaging them. So it was equal parts rewarding and equal parts depressing.
Do you think that's a common theme with a lot of people in medicine, burnout?
Absolutely, 100%. If you look at surveys of opinions, the majority of physicians regret going into medicine. The majority of physicians don't feel happy about their job. The majority of physicians don't think they make a difference. For many, many years, being a physician was I think still might be true. Some of the highest rates of suicides among professional careers in the United States. Very high rates of depression, very high rates of drug abuse and alcohol abuse. And I think much of it stems from that, from the fact that it never ends. It's just like this
Mhm.
torrent of patience, and there's never any time to rest, and there's no sense of accomplishment at the end. So it's very common, yes, sadly.